Let's stay with the COVID-19 distribution here in Nigeria as we get some perspective from the National Chairman, Nigeria Commissioners for Health Forum, Dr. Betta. She joins us on our flagship news. She doubles as the Commissioner for Health, Cross River State. Dr. Betta, thank you so much for joining us on our flagship news. You were at the meeting between the federal government and the Commissioners for Health from the 36 states of the distribution of COVID-19 vaccines to the states. Now, walk us through the takeaways from that particular meeting.
Okay, thank you very much. First and foremost, the meeting spelled out very clearly that the federal government has been able to get in at least 3.9 million doses of AstraZeneca COVID-19 vaccines into Nigeria, and these vaccines are presently in Abuja at the National Cold Store as we speak. Last week on Friday and on Saturday, they started on Friday with the immunization of frontline health workers at the National Hospital. And then, of course, on Saturday, they continued with the immunization of strategic leaders like the president and the vice president who took these vaccines, just to really drive home that point that the vaccines are actually free and they are safe, and there's really nothing to bother about as it concerns the safety of the vaccines and its efficacy, even in our own climate. One of the things that came up very strongly is the fact that the MPSCDA and of course the PTF will be supporting states across the country to carry out trainings for health workers on the vaccine management, that storage, logistics, composition, and other things that has to do with the vaccines, and of course the risk communication, which they need to really manage properly. By risk communication, I mean all the rumors, misinformation, information flying all around about COVID vaccines, working with key stakeholders, engaging communities to ensure that they can accept these vaccines as soon as they are in the state. Another very important part of it was the e-registration. So everyone who is going to take this vaccine must be registered and would also be given a card at the end of vaccination. This is done for vaccine accountability, so that Nigerians can say, okay, in the 3.9 million vaccines that have come in, we have given this 3.9 million and we didn't lose them to waste or any other form. Another very important part was that state was supposed to provide security for the vaccines as they come into their state and ensure the system is working optimally to ensure. A lot of work is presently going on now, and from the national, we should be receiving these vaccines by tomorrow in the various states across the country. They have asked us for the list of all health workers across the country, including the military and paramilitary health workers. We have submitted the same to the national. We have other parameters that have been met in the various states, and so states should be receiving theirs from Monday, and we hope that the governors across the country would be kind enough to take these vaccines, as well as the frontline health workers who are supposed to be prioritized in this time. Another thing which was very, very strong was the fact that, unlike other countries that are having the 4 week before the second dose, Nigeria will be having 12 weeks before the second dose.
All right, Dr. Betta, any reservations whatsoever about logistics and issues of storage and, of course, security of the vaccines, as well as the equity in terms of distribution to the states? And can you confirm for us, Cross River State, for instance, just how many doses are you expecting for your state?
So the final numbers that will be going to the states have not been released yet, and this was due to the delay in some states sending in the total number of health workers that are in their states, because the total number of health workers would actually determine how many you would get. They'll just add a little more for those strategic leaders. They're not supposed to be so much in the state, but apparently from the number of health workers that we have sent in, both those of the military and paramilitary, our primary healthcare workers, our secondary workers, those in the laboratory and other areas where we consider key. We've sent in their names into the dashboard. We should be looking at between 10 to 20,000 doses of the vaccines in the first tranche, and
All
then
right.
subsequently we would be getting in the second dose. Remember, this is just for those health workers and strategic leaders. The next badge will be for people who are above 50 and those who are vulnerable. By that I mean they either have diseases that make them more vulnerable to the disease. They have things on the like comorbidities, underlying diseases like diabetes, cancer, and other things that would increase their vulnerability to the COVID-19. So all of these are issues that are being considered.
All
For the
right.
storage,
Doctor,
a lot
just
of
one
states
final
still
question,
have
maybe in 60
issues.
seconds or less. How prepared is your state, and what's your strategy in terms of distribution, especially to the rural areas?
So really, most states have issues with cold chain at the local government and facility levels. But however, the first set that will be going into the state is quite a small number, right, compared to what we have been handling for other campaigns. For Cross River State, we're very prepared to receive our vaccines. Health workers have been encouraged to start their self-registration. And for those that are in hard-to-reach areas, we would go ahead with other registrations. We're having trainings right now going on. We're very prepared, and we believe that this week we'll get our vaccines and we would administer them as soon as we get them, because we don't want to store them for too long. By the end of
All right.
next week, we should have given out all of the vaccines to those health workers, frontline health workers that need to be protected.
It's such a delight to speak with you, National Chairman, Nigeria Commissioners for Health Forum, Dr. Betta Edu. Thank you so much for speaking with us on our news.
You're welcome.
So we'll be speaking with the Commissioner for Health of Cross River State, Dr. Betta.